afternoon, everyone, and welcome to this CAQH webinar, a cost-effective approach to COB that improves the member experience. My name is Rebecca Beatty. I am the Senior Marketing Manager at CAQH, and I will be the moderator for today's webinar. Before we get started, I'd like to review some housekeeping details for all those listening today. Today's session is being recorded, and by the end of the day tomorrow, you will receive a link via email to the on-demand webinar that you may share with others. The recorded webinar will also be posted tomorrow on our website. Your phones will be muted throughout the webinar today. All questions should be submitted online. You may ask your question at any time throughout the session. Simply type your question into the right side of the GoToWebinar panel. We will address your questions at the end of today's presentation. Now I'd like to introduce today's presenters. They are Missy Charlton, Team Lead for COB Claims at Premera Blue Cross, and Kelly McNair, Manager of Business Development at CAQH. I will now turn the presentation over to Kelly.
All right. Thank you, Rebecca, and thank you to everyone for joining today's discussion on coordination of benefits and CAQH's solution for a cost-effective approach to COB. So on the phone, we have folks from Blues plans all across the country. So some of your organizations are currently using CAQH's COB solution. And for some of you, this may be the first you're really ever hearing about our solution. But I know that each of you has at least two things in common. You work for a Blue plan, and you are most excited about hearing from Missy. So I am going to be quick with my part. But first, I wanted to just walk through the agenda of what we'll discuss on today's webinar. So I'm going to level set with the group by doing a high-level overview of CAQH's COB solution, COB Smart. And then Missy from Premera will discuss her organization's experience with the solution, the value that they've seen from making COB Smart an integral part of their COB process, and then some lessons learned throughout. And as Rebecca said, we will have time at the end for some Q&A, so please submit your questions through the GoToWebinar panel. All right, so I'm sure you all are very familiar with the challenges that exist with COB, and really most of these challenges are due to health plans not having access to members' other coverage. So really, without having access to this information, plans are forced into a reactive strategy that occurs after claims are submitted. And this leads to administrative burdens and inefficiencies in many areas. So patient access and eligibility, provider billing, routing, claim adjudication, EOB and claim payment, and appeals and adjustments. And so really, when claims are paid incorrectly, it is painful for all stakeholders. So plans are spending a lot of time and money trying to get other coverage information from their members, many times without much success. They're overpaying or paying claims incorrectly. They rely heavily on expensive vendors to recover overpayments. And overall, it's just a huge administrative burden. And then on the provider side, claims are not paid correctly or timely, and they deal with their own administrative burdens of dealing with phone calls to their offices about claims. And then there's the patient, who are oftentimes confused by these other coverage letters that they're getting, and they're really frustrated when their claims are not paid. So all of these administrative inefficiencies are costing the industry on average $800 million annually. And that's 800 million healthcare dollars that aren't being spent on care. So to think if only claims were paid correctly, this would not be an issue. And obviously that is so much easier said than done, but COB Smart was created to help plans do just that, to pay claims correctly the first time. So CAQH created COB Smart to give health plans the information they need to take a proactive approach to COB and to pay claims correctly the first time. And how we do it is we are capturing member data from all of our participating health plans, and we're identifying individuals with overlapping coverage across those plans. Then our built-in primacy engine determines the order of benefits using NAIC guidelines. And then we're sharing this complete COB information with participating health plans that they can then share with providers. So having access to the COB data has enabled all of our participating health plans to recognize value in many areas. So they're seeing overpayments minimized and as well as incorrect payments. They're seeing a decrease in their COB costs per member. They're using their vendors more efficiently and effectively, and they're making better use of their staff time. Then it really boils down to an improved member experience for all. Now, this slide shows all of the health plans that are currently participating in COB Smart. So you'll notice we have all of the big national payers and a number of regional payers as well. We've got 34 participating health plans overall that represent 165 million members. Of these 34 participating organizations, we have 14 Blue Plan participants. So we really do appreciate our Blues plans who utilize the solution. No one has ever terminated our contract or their contract with us. They are really seeing value in the solution, anywhere from 3-to-1 to 10-to-1 return on their investment. And with that, I am going to now turn it over to Mitzi.
Thank you, Kelly, and good morning, everyone. I am Mitzi Charlton with Premera Blue Cross. We are a health plan that covers about 2 million members in the states of Washington and Alaska. And you'll see we did put our purpose here on the slide. Premera's purpose is to improve customers' lives by making healthcare work better. I think that's certainly an initiative that most all of our plans are striving for. So the way Premera used to approach COB is probably very similar to how most of you are approaching it at your plans. We would send other health insurance questionnaires, the OHI questionnaires, through our FACET claims processing system. We would send those manually as well as system generated through that system to make sure that a member was receiving this every 2 years. And then for members who maybe didn't have a lot of claims activity and didn't quite hit that threshold to get a letter every 2 years, we would run mass mailing. And as many of you know, running a mass mailing, that's a huge impact not only to your COB team, but your customer service teams and the resulting phone calls that come in. So it's not a fun undertaking. And so that was our old process of capturing COB, and obviously as claims would come in, providers would, have data on the claims, enrollment forms, as groups would renew, and then our recovery team that we have internally and a recovery vendor who acts as a second catch to our recovery team. So those are all the ways that we would find out other health insurance existed, as very reactive approach. I'd log adjusted claims, chasing down money through our recovery team. So not really a very customer-centric solution that we had. So again, some of the challenges that we had with our former COB process, on average, each letter cost us $1. When you add in the cost of postage and imaging, we were looking at close to $200,000 per year just to find out if our members had other health insurance. As most of you also know, as you're familiar to COB, typically only 3%, right, is industry benchmark of members who actually have other health insurance. So you're essentially sending letters to 97% of your population that we know they don't have other health insurance. Just very wasteful. When it comes to the phone calls for members who would call our customer service teams, the average COB calls that we were receiving lasted 9 minutes or more in length. We then would have the overpayments that had already occurred once we discovered there was, primary health insurance. So then we have our adjustments team adjusting claims. We're chasing money down from providers. And the response from those questionnaires was very low. We get about 24% of our members would even respond, and the majority of those members responded with a no, I don't have other health insurance. Again, when we talk about customer experience, it's created unwanted homework for our members. So it's just a member abrasion. You want to come home from work at the end of the day, go to your mailbox, and you've got this complicated letter asking if you have other health insurance. It just was not a great experience for our members. And then not only do we get phone calls from our members, but then providers. Providers are trying to bill correctly, so then they're calling our customer service teams trying to figure out if there's multiple insurance, who's first, who's secondary. So that was the former process. COB Smart. So this was something that we had been approached with. We had seen at the NOPLG conference, so the No Other Party Liability conference that the Blues Plans presents once per year in the spring. And we were able to meet CAQH and see the COB Smart product and how it worked. And it's kind of the first time that there is a proactive approach to COB. It delivers a much better member experience. It's a much lower cost per member per year. The across-the-board cost for all health plans is 20 cents per member per year. I do believe some of the founding health plans, there's 4 or 5 that did participate in building this, and CAQH could give more background. They might pay 1 or 2 cents less per member per year, but they've provided some capital and really partnered with CAQH to help build this solution. But what's really nice about that is whether you are a smaller health plan like Premera, we have 2 million members, or you're Anthem with 20+ million members, we're all paying the same amount to get the same data. So it's just a very cut and dry across the board. It creates a better experience for our providers as well. They're able to see if the member did not disclose their COB data, they're able to see the data in our system. And we also will have reduced impact in customer service because we don't have a whole bunch of phone calls coming in on those OHI questionnaires, reduced adjustments in our adjustment teams, and reduced recoveries overall, because we'll now know about the other insurance before we take claims incorrectly. So we're really taken aback in a very good way at this proactive approach that's really never been done before. And also COB Smart, I will add, there are some other vendors that offer regional solutions, but CAQH is the first really sole source. They're the only ones that offer a national solution, and so that was really intriguing to us, like I said, along with the very cut and dry price points. All right, so making the business case. So as most of you know, sometimes when you see a thing that you really want and you know it's great for your business, it can be really hard getting some traction with your executive management and with your governance boards to make sure you can get that piece of budget to take on your project. So we saw COB Smart about 4 years before it was implemented. Sometimes that can get a little frustrating because you as the business owner know how much value. If you're very close to COB, and no offense to anyone that's higher up in that chain of command, maybe with a large health plan like Anthem, you have a director of COB who knows that. But for most plans, it's your team leads and your managers that are going to be really intimate with the COB process and can instantly look at this and see the value that's out there. So I think really making your case to management is, looking at the cost. Everybody's very cost conscious in how we reduce, those fees to our groups and our members. Again, we were paying $1 per letter for really just atrocious response rate. So we're looking at $1 per letter versus 20 cents per member per year for a weekly response file. The customer experience, so again, Premera's, what our mission is to improve our customers' lives by making healthcare work better. Doing this reactive approach of adjusting their claims, they get caught in the middle, they don't know why it's happening, we're sending them these letters. It's not a great customer experience. And again, I think all of our plans are kind of in lockstep of customer experience. It's front and center, and this is an excellent solution that does just that. Staffing impact. Ultimately, now 2018, we haven't quite realized this, but 2019, we're going to really be able to start looking at the staffing impact as we have reduced calls to customer service, reduced recovery actions, and the prevention of adding more to staff. One thing I will point out is Premera built into our project for 2018 2 additional staff members to join the COB team. Because of COB Smart, we have not done that. So for 2019, we are adding no staff to our team, but we're able to manage that work, and I'll get to that a little bit later. And then the validity of the data. I think for our ROI, our case to our management was, you know, going to that NOPLG conference. I know this is not a plug for that conference, but for those of you on the line who have been there, it is a excellent way for fellow Blues plans to sit and discuss best practices. And every year I go, and this solution is what everyone wants to talk about. And I think the third year in, because we were still having challenges getting this approved by our governance board, I flat out asked several plans that have this, okay, what do you hate about it? You've had it for 3 or 4 years now. What's awful? What's so awful about this product? And there's nothing they can say that's bad about the product. It works. It absolutely works. It pays for itself, and again, you're at the same time improving the customer experience, and you're reducing your overall costs due to COB. So definitely having those conversations, reaching out to other Blues plans, and you know, getting their input of how it's working and how they're managing the data that they're receiving each week is very, very valuable. Okay, so our current process of investigating COB is a little bit different in today's world than how we did it prior to implementing COB Smart earlier this year. So we get weekly files. Most of you know that's how COB Smart works. And to back up just a moment too, we can stay on this slide, but another case that you can take to management is we're required to have Section 111 reporting with CMS. So your IT department is already on a monthly basis exchanging information with CMS. This is identical. Now, we're not required by law to put your members age 45 and over on COB Smart where you are with CMS and the Section 111. But it really does tell the story that we've already built this file for this other thing over here for CMS. We're already loading COB with Medicare. This is identical. So letting people know, especially when they're not really familiar with COB and our processes of the chain of command, it's a really good way for them to kind of link what it is we're doing. So again, you know, weekly we receive files. Our IT takes that data in, puts that into a spreadsheet for us, and internally what we did is we had an analyst build us an Access database. And we've got some rules on that, and he dumps the spreadsheet, basically our weekly file, into that database. And what it does is it takes an 88-field spreadsheet, and it puts all the data in. It puts all the data in to a database, and it allows the team to bucket the work. So you can find where OHI is primary, OHI is undetermined, OHI is secondary. So it's been very useful for our team to be able to have all this data in a nice snapshot with just what the processor needs, and you know, load that into our claims processing system. For Premera, how we were warned by CAQH, and we were also warned by some of our fellow Blues plans out there across the nation that are using this. You're never going to get through all the data, especially the first file, and it is huge. They do a one-year look back for you. They're going to find those overlaps, and you are never going to call other carriers and verify every overlap. It is impossible. That is a true statement. CAQH was very transparent about that. The other Blues plans that have this long before us were very transparent about that. So we started thinking internally, okay, how are we going to approach this data? What's the best way to get through it? So what we did when we had our IT team build the files out in a usable format for the COB team, I asked them to add a column that would, at the subscriber level, give us the claim spend for each family. What that allows us to do is prioritize who we're going to pick up the phone and call other carriers to verify the data with, and who we're going to move on into another way. So what we have found is, again, at the subscriber level, we've found 68% of all of the overlaps are falling below $1,000 claim spend on an annual basis. So that means the other 32%, my COB team is going to go out, make phone calls to other carriers, coordinate properly, load that into our system. That is absolutely manageable for us. Our team can clear the findings, the overlaps that are identified each week. They are able to move through that inventory on a weekly basis. I have a team of 20 just to put that in perspective. What we do with the overlaps that fall below a $1,000 threshold is we load the COB records into facets in such a way that the primacy order is loaded as unknown, but we'll put in, like, let's say it's the Premera and Aetna. We'll type in Aetna, you know, the policy, the overlap dates, but we'll put the primacy at unknown, and what that does for us is maybe this person literally has a $0 claim spend for the year, but tomorrow they get in a car accident and we got $100,000 worth of hospital claims that are about to show up. Well, when those claims show up, the claim's going to stop and the COB team will be able to make a phone call at that point in time. So that theory is we're going to protect those future claim dollars, but we're going to focus our resources on making phone calls, you know, where there's some real dollars behind, you know, the findings. All right, and our team, or our COB here in Washington and Alaska, we do it at pay and pursue. So we cannot deny claims if we don't know if there's OHI or not. So we've always had a pay and pursue model. We have been able to avoid that entirely. Obviously, if someone shows up on the, as an overlap on our weekly COB Smart files, we can go ahead and make those phone calls and we can correctly deny if OHI is in fact primary to us. So this is our process. I'm more than happy to talk with anyone offline if you have any questions about how we do that. Again, we no longer send mass mailings, and our next step for 2019 is automation. So what we would like to do is have our IT department essentially take the entire weekly COB Smart files and load them all in as a temp load. And again, the COB team will actually go in for the 32% of folks that are that higher claim spend and make those phone calls. So right now we're having to manually load temp loads. There's a lot of inventory there, but again, we are able to really focus on the higher claim spend folks and get Premera's dollars back as well as our group's dollars back. So again, the benefits of our new process is this is all behind the scenes, no member impact. So, you know, as you guys may have heard through your own plans, the feedback you get from your members, when it comes down to it, the members really expect their health plan and their provider to coordinate and do whatever we need to do to pay their claims. They really don't want to be involved, and this really does take the member out of the whole equation and allows us to proactively set up COB. This is great for our providers. You know, gives them that information. COB is just as costly to our providers. They don't want to have their staff picking up the phone and calling us anymore than we want them calling us, or, you know, us calling them. And we've had no additional need for staff. Like I said, we've initially built in 2 additional FTEs, and we will not be adding staff to the COB team. And we've had significant cost savings that we do expect to continue to see heading into 2019, especially as we apply some automation to those files. All right, so some lessons learned. If I was going to share some things with any of you out there that are about to implement COB Smart, or you're getting close to that verbal green light, go ahead and try as best as you can to coordinate with your customer experience teams and your customer service teams. You know, they're looking at the customer experience. So try and consider the cost as much as you can in dollars and in customer experience of the current process. You're going to really want to develop a process for prioritizing the data. As I mentioned, I won't get into the weeds again, but we really looked at the claim spend at the subscriber level. There are some plans out there that do first in, first out. We feel we've had great success managing it based on claim spend. Utilize your fellow Blues plans out there that have COB Smart. I've reached out to a couple of program managers and team leads at other Blues plans and pick their brains saying, hey, we got the green light to move forward. Are there any landmines I should avoid here at my plan? Hey, here's how we'd like to approach the data. And one of those plans used to have a first in, first out approach. And when I shared with her how we wanted to approach based on claim spend, she actually changed her plan's approach, and they saw quite a big bump in the first quarter of her doing that. So that's how they're now managing that. Dedicated IT support is key. So we did have a point person in IT. I believe we had 2 or 3 developers that were assigned to that team. That one IT person, even though the project's technically over, any questions, any things that come up with COB Smart, that's our point of contact. And so it's just really important. If your plan decides to move forward with this, you've got to have dedicated IT support. Develop a tool for your team to capture the work. Working off a spreadsheet is not ideal. I know a lot of analysts and developers aren't in love with Access, and maybe your plan does have access to other, work sorting tools. Definitely be looking at that piece. You want a quick, easy way for your team to get the work. And to validate that as well. So the tool we have does validate the information we're getting from CAQH, so we are monitoring that real time. And anticipate 6 months for an efficient internal workflow. You're going to have little bugs and hiccups to work out just internally. People getting used to, your COB processors getting used to accessing the information a different way. Consider separate files for any restricted groups. This is one, we missed one, even though that ASO group participated in our project launch. It was after we went live that they said, hey, shouldn't we have a separate file? So we did build that in for them. It wasn't a huge thing, but it would have been nice that it was done up front. So do keep that in mind. And then also have a strategy in place to get the right permissions from your ASO group. So it's something we had all of our ASO account managers in a room, and everybody smiled and nodded up and down. And then when we were about 5 weeks from go live, it turned into, wait a minute, do we have a written confirmation that we can move forward with this group? So that would have been nice to have had completed before our go live date. What was groups, Premera went live February 19th of this year with COB Smart. One of our large ASO groups with about 125,000 members went live in late March, and then another one with over 200,000 members went live in late August. So while it would have been nice to have everyone all at once, it did allow us to kind of level load that work a little bit as we went live. So those are some of the lessons learned for that. And do know, those of you close to COB, it takes time to trend the data that you're receiving back, off of your report. So just let your leadership team know that. Everyone gets really eager. The biggest gains we saw, were out of our recovery teams. They were able to show us what our recovered dollars were month by month. Our providers do have 60 days to, voluntarily refund overpayments, and then, the recovery action takes place after that. So there's a little bit of a lag. We were in month 3 before we really started seeing real dollars coming back. Our plan, we have paid for COB Smart, not only for this year, but for the next, very many years. So it has not cost the company anything. Again, we're delivering a better experience for our members. That is about it in a nutshell.
Great. Thank you, Missy. We have now plenty of time for questions from listeners, so please submit your questions by entering them into the questions section of the panel on the right-hand side of your screen. We've had a couple of questions come through already. The first one is from Missy. Missy, is your COB area consolidated under one group?
It is not. So our ASO teams, so our large national accounts, do handle their own COB. And then every other group, about half of our company's business, we call that core teams. We handle all of that. That being said, we partner with our national accounts. We assist them with their COB. We're kind of the point people with their COB questions and concerns. And we held on to all of the ASO COB as they went live, and have just now, probably in the last 30 to 60 days, turned over our internal tool for those NAO COB processors to start doing updates. We really wanted to make sure that we'd worked out all of the bugs, and we went ahead and, like I said, handled their COB updates and investigation until we knew our tools were in good working order so that we could support them as we handed that off to them.
Okay, another one for you, Missy. Do you pass your CAQH costs to ASO group?
Oh, that is an excellent question, one that was brought up by our sales team and our executives. No, we do not. And we did partner with CAQH and also asking our fellow Blues plans, is anybody doing this today as far as charging those ASO groups the 20 cents per member? No, we don't do that. The expectation from our groups prior to COB Smart that cost a lot more money, their expectation was that we investigated for OHI. That was a service we provide for them. And so to now say we've got this cheaper solution, now we're going to charge you, it just did not feel that that was really the right thing to do or the expectation that our groups would have. Additionally, if you have some of these bigger players out in the market, the big guys that are out vetting for business, and their sales teams are using COB Smart as this great tool to go investigate COB, and they're not charging for it, but you are. I think that just really does not send a good signal. So we've made a decision not to do that. But like I said, it's been asked by not only our sales teams, but our higher level executives.
Okay, thank you. Missy, can you tell us a little bit more about how Premera manages the data that they get from COB Smart, specifically the staff used to work the report?
Yes. So the tool, and I'm assuming the question is kind of about that internal tool that was built. And what they're able to do is pull out of basically buckets. So it's an access database. There's buttons that are very clearly labeled. And CAQH with weekly files, some of those files will have what's called a 04 on the file where CAQH is saying, hey, we know the primacy. So we have a bucket set up where OHI is primed, and that's the bucket my team works first. So they can jump in there and they start making those phone calls and get those records loaded up into facets. One thing that we're able to do on the back end, the data is only as good as what you're giving other health plans and what they're giving you. So one of the things we wanted to monitor as we look at automation. In a perfect world, we will, automate the primacy, and we do plan to get to that point, but we're going to start with those temp loads that I mentioned. But what it's allowing us to do is there's radio buttons that the processor will click. Hey, was the primacy correct? Were the effective dates correct? They have to click those buttons before they can pull a new record. And again, it's taking 88 fields of data off the COB Smart file. It gives them just what they need. The member ID, the member name, who's on that policy that has overlapping coverage, who the OHI is. So really consolidating it down. It's easy for them to see, and they go ahead and load that in. It also gives them a count. So, you tell your COB team, so my team, I tell them to work between 60 and 90 minutes a day, depending on our claims inventory. Say you're going to work COB Smart updates for 60 minutes today. Well, at the end of their 60 minutes, they've got a count of exactly how many updates they did. So it's really worked out well for us to do kind of a quality control of the data we're getting, those primacy determinations, and see what the productivity of the team is as far as loading those records. So that might look different from plan to plan. I know for analysts, Access isn't their favorite tool, but it has worked really well for us to manage the data and see what the team is doing.
This question is for Kelly. Does CAQH have the ability to get exchange data from state and federal agencies?
Yeah, and so we do have this ability. We are not currently working with any state or federal agencies today, but we are talking to states. I know we're talking to New York State, and we're continuing conversations with CMS.
Okay, and will Medicare and Medicaid eligibility be included in the database?
So this is information that we're capturing for members that are coming through on the database. We're capturing information on the line of business that these members are representative of. And so we're currently working with health plans that have Medicaid and Medicare lines of business, and that information is included in the file that is returned to participating plans.
Okay, thank you. Missy, another question for you. Can you go into more detail about how you isolated the over $1,000 claim subscribers?
Yes. So now my IT team did the magic on that. Just said, this is what I want. And what we do is look at that at the subscriber level. So as you can imagine, maybe it's a $2,000 claim spend over the last year. There's 5 people on the policy. So now it could easily look like $10,000. You just go ahead and there's some formulas that we have where we kind of pivot charts. We get our member count and make sure, and the way that our analysts built the tool and team is, when you grab an update, it'll pull the whole family, but it understands to count for, John Smith's family, for example, count that $2,000 one time, not 5 times for each member on the family. So that was just with some SQL in the background, formulas to be able to, separate out what we have. I hope that makes sense, but whoever that is, my contact information is available. So if you want to reach out to me, set up some time for us to chat afterwards. I can try and get a little more technical detail for you.
Okay, great. Misty, do you use this data for pharmacy claims?
We do prioritize, yes, we absolutely do. And part of our COB process before COB Smart and since implementing it is our COB processors, when they call OHI, they are probing and asking the questions. Do you have dental? Do you have vision? Do you have pharmacy? So that is their standard work they've always done. We've asked them to continue on with that. What we do is we do prioritize. You'll see when you have the file and any conversations and data that CAQH has provided, there are, dental overlaps. There are the pharmacy overlaps. We do prioritize the medical overlaps. And then, like I said, our standard process for our COB processors is to be asking those probing questions once they've called OHI to see what else is out there. So when we know that there is pharmacy coverage, we certainly make sure that our system's caught up and make sure OHI is, covering that as the primary payer when appropriate.
Okay, thank you. We have another question. What was the ROI in year 1 versus subsequent years after COB Smart was implemented?
So really the ROI for year 1 is a little bit skewed because we knew doing a year look back on the data, we were actually going to see an increase in adjusted claims and an increase in recoveries for recovery teams. So that focus was, hey, we're gonna get this money back, yay. But from a proactive approach, the second year ROI is, okay, we're gonna have reduced phone calls because we're not sending out questionnaires. We're gonna have reduced adjustments. So there's going to be a impact staffing-wise in those teams. We're going to see fewer recoveries taking place, so a reduction there is in work as well, and a reduction in what our second patch recovery vendor is finding. So that's year 1 was more about, hey, we're going to get all this money back and figure out how to, manage this inventory and load it into the system. Year 2 is looking at automation and truly looking at, okay, now we've level loaded the work that we have. We've caught up with this year look back. We're proactively loading COB on a weekly, ongoing basis and updating anytime there's a change to that data. So now, year 2, we're going to start looking at the staff reductions and efficiencies that we're getting and really focus on, okay, now that we have this data, what did we save from a claims perspective, future state. So something similar that your recovery vendors might provide for you. Hey, we've saved you this money and here's what you've avoided in overpayments since we caught it. So that's what we'll be focusing on for 2019.
Yeah, and I just wanted to add on to what Mitzi said. I know I mentioned earlier that we have health plans reporting anywhere from 3 to 1 to 10 to 1 in terms of the return on investment. And we have excuse me, a lot of information about different health plans' value stories. So if you would like to connect with us offline, we're happy to talk in more detail about specific plans' return on investment.
Thanks, Kelly. We have another question. Missy, can you talk a little bit more about your implementation experience and how long it took and what that overall experience was like?
Yeah, absolutely. So we had project kickoff last October of 2017. We had some reorganization in our IT department. So the IT group that we were assigned for the first 30 days changed abruptly. We got a new IT group in November. So essentially, we kind of had to stop and go. It was what it was. Now, as far as once we had our team in place in early November of 2017, CAQH was right alongside. They were an exceptional partner with our IT team. I believe they had weekly meetings through implementation. And, you know, just worked side by side with our IT folks to do testing and help build out files. And we initially were going to go live in January. We decided to push that out until February, but we did not have any. It was amazing. Once we went live, we did not have any. There were no scary moments. There were no failures. The biggest thing we found after the fact is, one of our ASO groups that is restricted. Obviously, our employees had a restricted file, and then everyone else. Sorry about that, guys. That was the only oops, if you would, and it was very easily corrected and updated. So, yeah, we worked in lockstep with CAQH. They're a wonderful partner with us. And so really it was, November, 3.5, 4 months from truly when we had our IT team in place to send out our first live file at the end of February. So it was very, I don't want to say easy. My IT people would probably slap me, but it was kind of an easy, smooth sailing kind of a project. Like I mentioned, a really good thing to bring up, and maybe even talk with your IT folks that you have that are handling your Section 111 reporting. It's identical, but they're like cousins. So it's, when you can kind of get people to draw those correlations and draw those lines, they're like, oh, okay, it really is not that difficult, compared to some of the other projects that our companies take on, day by day. So, it's pretty smooth and easy. And what's nice about CAQH having, 34 plans, they've been through it before. It's a well-oiled machine. They kind of know where your IT team might be veering off in the wrong direction or can applaud you when you're going in the right direction. So they're a great partner. And like I said, about 3.5, 4 months, we were good to go from true kickoff to when we sent out our first file.
Great, thank you. One other question, someone was asking, when you were making the business case to senior management, were there any kind of misconceptions that you needed to clear up for them about COB Smart or about the data?
A lot of, how do I say this? We had a situation, unfortunately, where we had a high-level person way above my pay grade that went to a conference, and someone made kind of a tongue-in-cheek comment about the data from CAQH, and that spooked a lot of people. The data is good. This, like I mentioned at the beginning, this is more than paid for itself. In 2019, we're really excited to see what kind of efficiencies we're truly going to see from just, staffing perspective and avoided recovery action and adjustment. But some of the missteps were like, prove to me the data's good. Well, it's out there. You can talk to Sherry Murray at Anthem. I would encourage everyone at a smaller health plan to go talk to Sherry. It's the largest Blue plan across the nation with 20 million plus members. They were a founding member of this, and she's not wavering. When you sit and corner her and say, no, really, what's bad about this? Like, what's gone sideways? Nothing has. It's good data. And we all are using Section 111 every day at our health plans. We have to. But that's good data, and it works. So it's really, I think that was one of my strongest arguments, if you would, at putting everyone at ease. This is a very secure data exchange, and it's functioning in just the same way that you are already handling since 2009 your Medicare COB. So being able to allay the fears of our management team, because like I said, the higher up the chain you get, the further away they are from COB and our processes and truly understanding that. I don't mean that offensively at all, just it is what it is. Higher they're up, they're looking at so many different strategic things. They aren't as intimate with this as we all are. So it's just really important to line up all of that information, that they understand the data is good, and being able to talk about other Blues plans that successfully implemented this was very helpful for me and my leadership team. Because as you guys all know, your VPs probably know 10 other VPs of other Blues plans. They can pick up the phone and have a quick talk and just kind of verify and validate that themselves behind the scenes. So I found that those two things really helped me push that forward. Like I said, all it takes is one person high up enough to hear one tongue-in-cheek comment, and they're spooked, and nope, we're going to move this to the next year. And that was a little setback that we had a couple years ago, but everyone has been thrilled with the results we've seen. There are no regrets or oops, we should not have done that. And like Kelly pointed out of all the 34 plans, nobody has canceled their contract. So this is good data. And there are vendors out there too. If you're thinking to yourself, do we really want to keep this internal and handle this? There are vendors who will take those files and scrub the data for you. Obviously, if they find recoveries, you're going to pay them, 20 to 30%, whatever their fee is, to go get that for you. But that is another option. And I do understand that we do have some Blues plans out there that, if not all of their files, they'll give a portion of their files to recovery vendors and let them scrub the data. So there's a lot of different approaches. Premera chose to keep it internally. We want to maintain that quality and that high touch and see what we see. And so far, it's been very successful for us.
Okay, thank you. Can you speak to how you eased your staff's mind about working with and through the huge volume of the initial file, and then also how long it took for your team to adjust to the weekly file workload?
Yes, another great question. So by the end of August, we had worked through that initial file. And I did mention we have a large ASO group with over 200,000 members. Go live the end of August, so that bumped us back up, and we are assisting our national accounts with working that data down. But as far as 1 million members who'd been through the file, we went live. We received our first file a week after February 19th. And we had that backlog taken care of by the end of August. What we did is, obviously, our COB team, we have claims inventory that we also have to manage. So we are a little different the way we're set up in some Blues plans. Some plans, they have a COB team that is, they've got folks that just do the investigation, and then they have another team that's just the claims processors. At Premera, our claims processors also do the investigation. So one thing we did to assist is we actually had a customer service team that was overstaffed by 10 FTEs. They were offering voluntary time off. And we went, ooh, can we have those guys? So what we did is we coordinated classroom training for COB. How we normally train our claims processors is off the side of a desk with your TSSs, and it can take a long time. What we did is we quickly pulled together classroom training, and in 2 weeks had 10 customer service reps fully trained on standard COB updates, which was amazing. It also helps develop them, right? They go back to the phones, they understand COB, so it really was a win-win for customer service and for claims. And so having those 10 folks on loan to us 4 days a week through the end of August was able to assist, because all they did were COB Smart updates, and then my team would still handle claims, but they'd still have 1 to 2 hours a day, plus we did have some overtime built into the COB Smart project. They were also doing this update. So we managed it through overtime. We were able to cross-train customer service reps, and like I said, it was a huge win, I think, for our organization overall, because now you have customer service reps that are that much more knowledgeable about COB out there answering phones each day and reducing what does get sent back to your claims team in the form of questions. So that's how we approached that, and they do still jump in when their call volume is low. Of course, we're in open enrollment now, so we probably won't see them until after the first of the year, but they've been incredibly helpful for for our COB team.
Okay, great. Thank you so much, Missy. At this point, it looks like we do not have any further questions, so we will go ahead and conclude the webinar. I want to thank everyone very much for joining, and as a reminder, tomorrow you will receive an email with a link to the recorded webinar that you may share with your colleagues. We will also be sending out a case study version of what Missy presented if you would like a shorter version to share with others who were not able to attend the webinar. And of course, you may also visit the CAQH website at cobsmart.org for more information, and you can always email our sales team at sales@caqh.org. Thank you so much, and goodbye.